And we want to welcome back Paul Seegert to the program. He is here again this morning to talk about the vaccine mandates and what a burden they have put on our already stressed out healthcare system. And he also he has a unique perspective on all of this because he's the managing partner at PCS Advisors. This is a benefits consulting firm. So he will share with us what he thinks is happening. Good morning, Paul.
Good morning. How are you today?
Doing well. So what do you have to say? Break it down for us on the vaccine mandates. You know, they're trying to decide whether they want to. You know, we have a big industrial base. I may have mentioned this to you before. Here, where fortunately for a lot of the employees at 3M in particular, they, kind of ceased and desisted on theirs, at least for the time being, as well as the hospital. What do you know about all this?
Well, I think a lot of employers are in the wait-and-see mode because it's gotten to be so confusing. So many, it's changed by the day with courts putting in stays and so on. And so I think a lot of employers rightly have decided to be in the wait-and-see mode. Before the OSHA mandate was announced, 85% of employers said they would have some sort of policy of their own design by the end of the year, this past year. And at the end of the year, because of all the confusion, only 18% did, and only another 7% said they will no matter what. And the rest of them, I think, are waiting to see what happens. And, of course, Friday it was before the Supreme Court. And it seems to me, my interpretation of what we saw in the oral arguments is that the OSHA mandate is likely to not survive, not hold, and the healthcare mandate probably will, or in some form it probably will. So that one seems to have legs, which is unfortunate for more rural health systems that are already struggling with staffing issues, and really the whole health system.
That's true. Especially since this resurgence of COVID, in 1 week we here had a record-breaking 560 positive cases, and that's a lot for this part of the.
You've got, and actually you're seeing it all over, and even in large urban areas and big health systems, whether you're urban or rural. The typical hospital right now is they're not even using all their beds because of staffing shortages. They've reduced capacity 3 to 10%. They've got 5 to 7% of their own employees out with COVID, despite the fact that most of them are vaccinated. They're still getting COVID, and that's hurting their ability to staff their facilities. You probably saw this past week the Mayo Clinic fired 700 employees. That represents about 1% of their workforce. And we're at a place where it really makes you scratch your head. We're so crazy that you have health systems firing people for not getting vaccinated, but allowing COVID-positive employees who are vaccinated to work and treat patients.
That's what I was going to ask you about, because I saw that news story this morning, and I was like, what?
Mm-hmm. Even in California, which is supposed to be the beacon of progressivism, and in all things, they just announced that they're allowing and even compelling or forcing hospital staff to continue to work if they're COVID positive and asymptomatic. They're just having them wear a mask, and yet firing people that are COVID negative that could treat those patients and happen not to be vaccinated. And we're really at a crazy point in this whole process.
And that's one of the things that's kind of a disconnect for me and the other host here. I mean, why would you fire a bunch of people who were heroes in the beginning, and now, what's going on?
Well, I think we're at the peak of virtue signaling in this experience. I mean, you have 90 studies now that confirm that there is such a thing as natural immunity. Most all other of our peer countries recognize it, and we don't, because we have such a powerful pharmaceutical industry, frankly. And here we are firing people that almost certainly were exposed. If we were just to give them the option to get tested for antibodies and T cells and so on, I'm sure most of them would probably show that they had have some form of immunity. And all these CEOs will come out pretty consistently and say, well, only 99% of our staff are vaccinated. We only had to fire 1%. That doesn't account for all the people that have left the workforce from burnout, who left in advance of getting fired and just decided to shift their careers, retired early. We've lost 540,000 healthcare workers in the process of this pandemic, and we're in the process of losing another 500,000 nurses are projected to leave in this coming year. We're going to be at a staffing shortage of 1.1 million nurses by the end of this year. And so that doesn't so that's, I think, the other part of the math that they don't talk about. And then you have hospitals all over the country that are reducing their capacity because they cannot staff their facility. I mean, that's where we're at. So does it really make sense to fire these folks and not be able to treat people and delay treatments for things? You really have to question that, I think, if you're a logical person.
And you are hearing you have offices all across the country. What are you hearing from other benefits consulting firms, other offices from PCS Advisors?
Well, we partner with quite a few offices around the country, and we're all hearing similar things, that employers they're basically tired, and they're facing the toughest hiring environment that they've faced without mandates. This is the toughest hiring environment they've faced in 15 years, with the Great Resignation going on. All the money that was pumped into the system has put some people in a position where they've chosen to temporarily or permanently leave the workforce, retire early. And so you now have employers struggling in all industries, not just healthcare, to staff their companies. And then the mandate comes into play, and if they're a really large employer, with 60 or 70,000 employees, that's one thing. But when you're an employer that's affected by the mandate and you have 150 employees and you provide a skilled labor-type service, you can't afford to lose 2 or 3 of those skilled craftsmen that you have and continue to operate at the same level. I mean, it could have a major impact on your company. So 1 in 3 of those employers tell us that they have serious concerns and fear of a mandate crippling their business and their ability to perform.
And Paul, in your eyes, what would be the best case scenario to get past this?
Well, I think we're going to see it start to wind down. What we're seeing from the Omicron variant is that it causes less severe illness, and so it's going to get through our population. It's getting through rather quickly, and we're starting to see, I think, the powers that be are going out on news shows and saying, look, they're becoming more honest with our population as to what's going on overall. The fact that we have a lot of people that are hospitalized with COVID, not because of COVID. In New York, as an example, that represents about half of the numbers that they've been reporting. They just, in the last few days, came out and started to separate them out so people would know the difference. And that's something that you could get in the data the whole time, but it wasn't widely talked about. And then we're not all at the same risk. I think we're going to see a lot of this start to wind down. I think we're in the final stages of this, and we're going to have to get back to normal because it's going to be here.
Well, now, with the home test that is supposedly going out sometime, we're really not going to. We're going to be under the 8 ball, not knowing how many people are sick. If you can take the home test and test positive, and then just self-quarantine or whatever, that's going to cause the numbers to be a little skewed, isn't it?
Yeah, and they really have been the whole time. I mean, we've got a lot of the hospitalizations. They test you when you show up at a hospital, and you're there for another service or another procedure, and you're asymptomatic, and then they're counting those in the numbers. Same thing with COVID deaths. Some people are dying with COVID, not from COVID. So the numbers have been a little misrepresented through the whole process, and that'll continue. There's no way around it. But I think it's there's some good news in there. A lot more of us have had COVID than even realized, and that means that the population as a whole has some level of immunity, and that's partly what's going to get us through it.
And, you know, you are also hearing that, and this is common, that even people that are vaxxed and boosted and all that kind of stuff are getting it as well.
Yeah, right.
So then
I
that...
think we have to acknowledge it's endemic. It's going to be here. It's like the flu, and the fact that it's going to be a part of our lives going forward, and we have to learn to live with that.
And so that right there, but I've spoken to people who refuse to get the vaccine and that sort of thing. And as far as that's concerned, it boosts their argument that the vaccine does not work. That's, what they say.
Yeah, it's certainly, we are victims of our own bad messaging. I think we told everybody if you got vaccinated, the vaccine or the virus would stop with you. You wouldn't be able to transmit it. You wouldn't get it, and you wouldn't get seriously ill. And the truth of it is, you can still get it. You can still transmit it, but it does protect you from serious illness.
Right. Well, we have been speaking this morning once again, and we want to thank Paul Seegert for being with us. He is the managing partner at PCS Advisors. And Paul, where might our listeners find you or more about your company?
Yeah, you can find us online, PCS Advisors with an ERS.com, and we work with employers to navigate the healthcare system and lower their costs and improve benefits for their employees. We do on a daily basis. We're happy to help if we can.
All right, Paul Seegert, thank you so much for being with us.
Have a great day.
You too. Bye-bye.